Hey, I'm Dr. Blaylock, owner and founder at Lakeside Dental. I have patients that come in that have a lot of questions about veneers and what can veneers do for me? Can it straighten my teeth? Can it realign my teeth? Can it change the whole look of my smile? The short answer is yes. Now, like anything else, there's not a one size fits all. There are certain things we have to consider. The most important thing for me is what are our patients? What are your expectations? Where do we want to go? From there, we can work backwards on creating a plan, whether that's veneers alone or veneers in combination with other treatment to get you the smile that you deserve and the smile that you've always wanted. If you have a crowded tooth, think about a tooth that's angled like this. I can take a piece of porcelain that looks like the front side of a tooth and make it thicker on this side and put it over the top of that tooth to where instead of it looking like this, now it's like that and straight across. So who would be a good candidate for veneers? The first thing we do is we start with a comprehensive exam because we have to make sure that your teeth line up properly. If for whatever reason, say your bottom teeth hit too hard against your top teeth, if I go in and try to put veneers on those teeth without fixing the issue of these bottom teeth busting up against these teeth, they'll end up breaking the veneers. So sometimes patients need a little extra help where we do something called clear aligners or clear braces to help move these bottom teeth in a little better spot so when we're closing, it's not going to hit those veneers. Are there risks in masking crowding with veneers without using the help of, say, orthodontics or clear aligners? Certainly there are in specific instances where you have a higher what we call bite risk, which means your teeth come together in maybe a less than ideal situation. So when you come in for that initial consultation, we look at several things, not just your expectations and what we want your teeth to look like, but also how successful do we think veneers are going to be for you? How do I approach treatment planning when someone wants a straight smile fast? This is the day that we live in, right? Everyone wants something really, really fast. And some instances, there's ways that we can do that. It always starts with what's your expectations? Do we have a wedding that we're trying to prepare for? Or do we have an interview, an event? Is there something? Is there a deadline we're trying to meet? And then what can we do to reach your goals within the timeline of your deadline? Sometimes that involves phasing treatment out and having a quick temporary solution and then coming back in a few months later to provide a long-term stable solution. Both would look very great. One just might not be as sturdy as the other. I have so many examples of patients who have chose veneers for their teeth where it's dramatically impacted their life. And what I see most is their confidence and their self-esteem. And it's like this snowball, right? For whatever reason, when you see something that looks really nice in the mirror, you get this better self-esteem. And when you feel good about yourself, you want to do other small things that are going to impact your health. So I've seen patients get veneers on their teeth and they come back and their blood pressure's under control. Their diabetes are under control. I've had some patients who have lost 50 pounds just because we put veneers on their teeth and they started making these different choices. It's got to be one of the most rewarding things and touching things really that we do in our office for these patients. Hey, listen, if you're considering veneers for your smile, the first step would be to reach out to our office. You can do that in two ways. Number one, the easiest way is just send us a text message. It's an actual person on the other side of that we're responding and texting you back. And then number two, an old-fashioned phone call. We have ladies in our office who would be more than happy to speak with you about what your concerns are, your goals are, and getting you scheduled for a consultation with me to discuss how veneers might be able to change your life.